Mr. Estrada. It's a pleasure getting to meet you again. Last time you were here, we took you through our physical examination. We also went through some other tests to try to see what problems you were having. This visit is what we like to call our report findings. It's very important here at D's Chiropractic. In fact, we consider it to be the most important visit that you're probably going to have under your time and with our care. The main thing is we're going to help educate you about what the problem you actually have is, and also we're going to give you some pretty important decisions as far as taking care of your care. The main things we're going to cover today is we're going to cover the cause, severity, what my recommendations are to try to fix that problem, and also the prospects for correction. So what steps it's going to take, what you can expect from me, what I can expect from you, sort of deal. Okay. This board is entirely based on fact, and it's a professional evaluation through all the exams that we covered last time. Once we have identified the source of your problem, we'll recommend a course of care that will be presented to you. Then you're going to have a decision to make. I can only present you with facts and describe things that you need to do to correct the problem. But a lot of this is going to come from your own personal decisions if you follow through with care, if you come to your appointment, if you do things that actually do outside of the clinic. The length of time that you're actually going to be under care is going to depend on a few factors. One, it's going to depend on your compliance. It's also going to depend on lifestyle. That can be things such as amount of sleep, diet, exercise. All these things are going to be important to get you back to the health that you're wanting to achieve. We're going to monitor your improvement through progressive exams and reports that will track your progress. We're going to shoot some more x-rays down the line so we can kind of see which way we're going. Okay. Of course, I will always share these results with you, and we're going to compare them with the original, because I want you to see, hey, this is working, you're getting better, because I think you'll be as excited as I am. Regardless of the results, our recommendations are guided by the facts and not by wishful thinking. We don't leave anything up to chance here at D's Chiropractic. We're a fact-based business, and we're going to present them to you, and we're going to form a pretty good partnership. All right? Okay. So now I'd like to actually get into the report of findings for you, and this is going to be your copy as well. You can take this with you, keep it in a file. We're going to keep a file here, just so that in the future you'll be able to compare and kind of see where you started and then where you're going to be at when we give you care. Okay? Go to the first page. There are really three aspects of chiropractic care, and that's the initial care. So that starts the moment you walk through the door and make the wise decision about health. That door. In your case, you explained to us that you were having some debilitating migraines and was also having some trouble in your neck that was kind of giving you pain. Looking at the patient history that was performed, some of the things that kind of stood out to me were that you said that you're really only getting about 4 hours of sleep. You said that you do a lot of computer work, and I kind of took you through a little evaluation to see how you sit at your desk. Noticed that there are some things we can improve there. Based off what you tell me, I know that you have a pretty hectic schedule with the wife and kids, and y'all are always on the go. And I know you say you spend a lot of time doing some fast food stuff. So we're also going to look at some diet choices along the way that also can help improve your prognosis. Looking at the physical exam, we went through a series of standardized tests that helped you evaluate where you are neurologically, muscular, cardiovascular, skeletal, and respiratory system. Our initial neurological exam, we didn't find anything significant, which was a good sign. Orthopedically, when I was taking you through that active range of motion, you remember evaluate further. None of the rest of them were positive though, so that's a good sign. Upon physical examination, nothing really stood out too much. We noticed that you had some swelling in your lymph nodes. But you know, you said you'd been suffering from a little bit of a cold, and I know it's that time of year, and back to sleep and running around with kids and all that will probably contribute to that as well. So we're going to monitor that as well. Noticed also you had some tender musculature upon palpation at the base of your neck too. So that's our initial care. The second phase we'll go into is what we call reconstructive care. And it's specialized care designed to correct the BSC and reestablish your health. Now, I know we use that word a lot. We abbreviate it. I know we talked about it when you first got here, that vertebral subluxation complex.
Okay.
And what that is, just to reiterate what we talked about last time, is a condition where the spine malfunctions and causes an imbalance or damage to your nerve system and your overall health. And that's a word that, through Dee's Chiropractic, you're really going to learn to know what it is and really appreciate some of the health ways it can affect your health. So, looking at our initial back to your visit, we know some things when we were palpating. You had some issues, pain, tenderness, some tight muscle fibers up here at the top in your cervical region, which definitely lends to your chief complaint. That's kind of the reason what was causing some of these problems. We also noticed some stuff in your lower back that you didn't really know was there at first, but once we got you on there and started palpating, that you noticed. This also seems to be causing some kind of compensatory problems in your thoracic spine. With that lumbar and cervical kind of being out of the way of this side of the body will move to try to compensate that. So we're going to try to fix these problems first, and then we'll see how that takes care of the compensatory. Doing a leg check, which is something we use to evaluate BSCs. We noticed that your right leg was about a ½ inch shorter than your left. That's something we'll also correct. Looking as far as your range of motion, most of that looked fine. Your rotation looked normal on both ways. You did seem to have a little bit of a mild restriction as far as lateral bending in the neck, and also a little bit of lateral bending in your lumbar spine as well. Looking at the second part, the secondary phase, the neuropathophysiology. Basically, what that is in your house. I'm just going to use a little analogy. Where does all of the electricity come from? Like, where does it start?
Circuit breaker.
Yeah, the circuit breaker, exactly right. And that's kind of the same one thing that's going to happen in the body, is your brain is kind of like this great circuit breaker for the body. You've got all these nerves, kind of like the wire that runs all through your house. What would you think would happen, say, in one of your rooms away from the house, if something was to happen to some of the wire in there? You'd probably have some issues, right?
Yep.
It's kind of the same way in the body. You get out away from the body and something interferes with a nerve, you can expect there to be, it can't function optimally if there's an interference and something keeping it from doing its job. It's the same thing in the body as it is in the house. And so we look at some of these issues. In your case, we noticed with some of those tight muscles and palpation, it felt like some things had moved and changed.
Okay.
What that does is that can put pressure on nerves. Doesn't take a lot to make a nerve malfunction. So once this nerve is impacted, it can start causing things like toxins to be released. It can have less. It actually functions at a non-optimal level. So those are things that we're going to also try to correct. Myopathology, where we have imbalances in muscles.
Okay.
I noticed you said that you get a little spasm every once in a while, especially after a long day sitting at your computer. That's probably because something is causing that muscle to be in be in a state that is not its normal range. So it doesn't take much to be out of that normal range to start causing some kind of dysfunction. Histopathology. So this is just kind of just to show you how this can change over time. As you can see, the tissue here, you've got nice wide space in between your joints. As you can see here, you're starting to notice some changes, a little narrowing. This is even narrower, and you see the bodies are even changing structure. Of course, I'm sure you can realize this. This is not a good thing.
Oh, yeah, no.
You know, it's not good at all. These discs are important, and you're transporting all this information, like we said in the neuropathophysiciology. Like this electrical signal is trying to come from your brain. If there's something that interferes with that, it's going to be an issue. Okay. Looking at the actual spine itself, this is why we shot those X-rays. We wanted to kind of take a look at what your spine looked like. I'll show you this one right here. This is what we consider near normal. As you can see, the joint spaces look good. They're even distribution. The bodies look symmetrical, which is also important. This is kind of what we strive for. This is the patient that's probably been under care for a while, that doesn't have a lot of things that would impact them, impact their spinal health. This is what we achieve, we strive for all patients. If you look here in this next phase, is phase 1. There's a little bit of change in the structure. It's not quite as good as our near normal level. The joint space still isn't bad, but there's still some issues, like you see here. That's different from that. Yeah. There's still not any major tissue degeneration going on. So that's a lot more common than near normal based on the lifestyle that most of us live these days. Phase 2. This is, you see the spine is really starting to change. Yep. You're starting to get some issues. On to phase 3, wow, look at this. Like they're almost one whole vertebra. Yeah, and this one is completely fused together. So that's, obviously, you get that, you're going to have issues. That's very poor for your spinal health. Looking at your X-ray, this is yours, this is near normal. Looking at these other 4 phases, I want you to look at this and say, which one do you think yours would, which category do you feel like yours would be in?
It looks like I fall into a phase 2 right here.
And you know, based on my professional opinion, that's also what I felt as well. Like on your X-ray, there's a little bit of change on some of the end plates that kind of remind me of that. That means that there's probably a little degeneration going on, but that's something that we're going to work to treat. Okay. Okay. Lumbars. Looking at your film. This is near normal. As you can see, start losing disc space pretty quickly in phase 1 to really small amounts there, and then we start getting that fusion again, which we definitely don't want. Which one do you feel like you're in this one?
I definitely look like phase 1 on this.
I agree. You don't have the loss of the curve that you'd see in phase 2. Joint spaces are a little more narrow than this, and so I agree with you 100%. You're still probably getting a little degeneration, but not as much as if you lose that curve or if your things start fusing together. So, looking at your vertebral subluxation complex, a lot of these things are stop the degeneration where it's at and stop any kind of calcium spurring. Usually once you get to phase 3 or 4 though, it's kind of hard. We can usually stop it from getting worse, but it's going to be hard to make it get better. So okay. As you can see, you had a phase 2 here, so that's something we really need to address. Once we start getting you under care, we can kind of get a better idea of how much reconstructive care that it's actually gonna take. And then wellness care. Once we kind of get you back to where we want to, so closer to that phase 1 or near normal, we'll begin wellness care. This is great for us and great for you as well. That means that we're only seeing you probably once, twice a month, tops, just to make sure that we've got all the little things in check. Also, we're able to keep an eye on you as far as your lifestyle and diet so that you're not getting back into these habits that kind of got you to where you're at right now. So this is basically like maintenance for your car. You know, every 3,000 miles you got to change the oil.
Yep,
you know,
yep,
you got
you gotta
to.
do
If not, you can wind up with a huge problem. And so think of that as kind of like that. This is your body's maintenance, and we're going to help you during those steps. Initially, my recommendation is we probably need to see you 3 times a week for the first 4 weeks. In that time, we're going to work with you and try to implement some things that are going to help return you to care. We'll then reassess after 12 visits to kind of see where you are and kind of see if we need to increase or decrease the amount of times we're seeing you. Hopefully decrease if you're complying with us, and we're getting the reaction out of your body that we want.
Okay.
But definitely, it's going to take work on both our parts. I can promise you that I'm going to do my best ability as a doctor to get your spine and alleviate the symptoms that you came in here with. It's going to take some work on your part. I'm going to give you some exercises. I'm going to give you some things you need to do outside of the clinic. Some of these might include lifestyle changes and diet changes and stuff like that. I need you to be strict and to follow, because if not, it could impact the results you're going to get. And then it's going to take work on both the parts. We're going to stay diligent. I'll be here for all your visits. You be here for all your visits, and we'll see if we can kind of get this thing correct. Okay?
Okay.
Mr. Estrada, it was a pleasure meeting you, and I look forward to being able to work with you at Chiropractic. Have a great day.